Yo, what's going on, everybody? Tim here, XGP Rockarchy, and today's stream is going to be a little different. I've been thinking about doing this, and tomorrow is my state board exam, the written. So I've been studying all day this morning since 10 a.m. So I thought, well, I want to do a live stream as well. So I went ahead and put a barber pole, animated green screen pole up on the start screen and here on the just chatting screen. I don't have it on any of the other screens, but we will be doing Gears of War, the Gears-a-thon later today, and I realized that I still have some pieces of Gears of War 3 to do, which is the Ram's Shadow DLC campaign. So we're going to be doing that later today, but for right now, I need to study these particular chapters. Let me grab my list. So the chapters that I need to work on, because I did take this exam already, I'll just give you the rundown of what I scored on here. So rules, regulations, and safety, I got 24 out of 33 correct. Hair, scalp, structure, and care, 6 out of 11. Shaving, beard design, 11 out of 16. Hair cutting and hairstyling, 21 of 28. Chemical services, 11 of 11. Skincare, 6 of 11. So skincare and hair, scalp structure, and care were the two that I knew that I was going to be struggling with the most when I went to go take the state board exam. And I would show this to you, but it does have my address on it, so I'm not going to do that. But anyways, I have the exam paper here on the chapters that we need to do. So this is currently chapter 9. I've been studying a lot of chapter 4 to try and get 100% on that, and that would have made up the difference on what I would have passed or not passed. So I needed 83 correct answers total. So I only got 79 total correct out of 120 questions. What I will do is I'll just read this to you. So it says, to achieve a passing score on this examination, you must have had 83 correct answers. Your eligibility is valid for 1 year. If you fail, you may retest unlimited during the 1 year eligibility period. If you do not pass within the 1 year period, you will need to go back to your education provider to get your eligibility file resubmitted to PSI. So PSI is the testing, and then I went to Ivy Tech to do this exam. So we're gonna go, and so this is the Howard Brown online YouTube channel. And if you guys are studying out of the Malati barber book, so this one here, Malati or Malady, whatever you want to call that, if this is the book you're using, there is a book online that you can get, which is just the questions, and then all the answers are in the back, so you can study with that. But I will tell you that question for question, and then in the same order, they're right here on the YouTube. So instead of paying $60 for that book, I mean, you can still do it. I bought it not knowing that these questions that he's asking, and then the book for the practice exams for every chapter, I didn't know that they were the same as his YouTube channel. So if you want to save $60 and not buy that, or even save 20 if you buy it used, just get on YouTube, look up Howard Brown Online Barber College. So the way that I'm going to do this is that when I answer I'm going to let him go through it, and I am going to use the time that he gives available to answer it. And if I don't know the answer or I get it wrong, we're going to go in our book and see if we can find an explanation an explanation on why that's the answer, because that will help us retain it. So I did the same thing with Pokemon. I've done the same thing with Magic the Gathering. I've done the same thing with Yu-Gi-Oh! I've done the same thing with World of Warcraft, Gears of War. Any game that I've ever played, I've used the same studying technique. So to be able to run tournaments and stuff for Magic the Gathering, you had to remember the comprehensive book, and then remember in what order do cards resolve, and then you have to read those cards, understand how the cards work. So this is, they're going to ask a question, I'm going to answer it. If it's wrong, I'm going to go find out why I thought it was something else and why I didn't know the correct answer. The most obvious reason on why I don't know the answers, because I will read the chapter, but I can't retain everything. So having already taken the state board, we have 1, 2, 3, 4, 5, 6 categories, and now I actually know what categories they are. And then I also wrote down what chapter each of these categories were. So let's just go ahead and get started. Let me know if you guys can't hear this, but I'm going to push play. I'm going to check the sound bar, so it should be heard. And I do apologize if you guys can't see entirely what the video is showing right here next to me. But I'm going to pull it up real quick to see how big it is on the playback. Yeah, it's tiny, so you guys can barely read it. On what part of the body is the skin the thinnest? The answer is eyelids. But anyways, let's get started. This video is 47 minutes and 33 seconds long.
Part of the body is the skin the thinnest? Is it the shoulders, eyelids, scalp, or hands?
It's the eyelids.
On what part of the body is the skin the thinnest? Is it the shoulders, eyelids, scalp, or hands?
We're going to go with B, eyelids.
If you chose B, you are correct. Eyelids. Which of the following is the outer layer of the epidermis?
The stratum,
is it the stratum
corneum.
granulosum, the stratum spinosum, the stratum corneum, or the stratum lucidum? Which of the following is the outer layer of the epidermis? Is it the stratum granulosum, the stratum spinosum, stratum corneum, or stratum lucidum?
Okay, so just for this, I'm going to go here where I'm capturing my monitor. I'm going to alt this, and alt that, and alt this. This way, you guys might be able to actually see the question. Bam. I'm going stratum corneum. We also have to watch for YouTube ads.
If you chose C, stratum corneum, you are correct. The epidermis contains no blank, but has many small nerve endings.
We're going to go blood vessels.
Is it melanin, keratin, fibrous protein, or blood vessels? The epidermis contains no blank, but has many small nerve endings. Is it melanin, keratin, fibrous protein, or blood vessels?
The blood vessels.
If you chose D, blood vessels, you are correct. What epidermis layer is responsible for the growth of the epidermis?
That is a stratum,
the stratum
germinativum,
the stratum corneum, the stratum granulosum.
So the way I remember the stratum germinativum is because when something germinates, that means it grows like a plant.
Or the stratum spinosum. What epidermis layer is responsible for the growth of the epidermis? Is it the stratum germinativum?
My dogs keep going behind the chair.
Stratum corneum, stratum granulosum, or stratum spinosum?
Germinativum.
You chose A, stratum germinativum.
I don't know what correct. The granulosum or the spinosum is.
Tissue,
I don't know what those are.
Also known as blank tissue, is a layer of fatty tissue found below the dermis. Is it
that's
elastic,
adipose,
fibrous, adipose, or connective?
That is the adipose tissue.
Subcutaneous tissue, also known as blank tissue, is a layer of fatty tissue found below the dermis.
The only reason I remember that as fatty tissue is adipose.
Fibrous, adipose, connective.
I think if I just read all the terms,
If you chose C,
I would
adipose, you
remember
are correct.
most of these instead of reading the chapter because there's a
What
lot of
substance lubricates
filler information.
the skin and preserves the
That's the sebum.
softness of the hair?
So sebum is the
Is
one that
it
lubricates.
collagen, melanin,
It also makes if you
elastin,
have
or sebum?
also if you have an overactive sebum, which is your sebaceous gland, that can cause your hair to get oily. So you want to use shampoo and conditioner that's I don't want to give you wrong information that will cleanse but then re-moisturize your hair.
What substance?
Basically, shampoo is the stripper and strips the oil out, and then the conditioner is the one that puts the oil back in. That's why when you have that shampoo conditioner combination, it's not really the best option. I mean, some of them work, but it's not the greatest. So getting those bottles that are shampoo and conditioner separated are a better option.
Lubricates the skin and preserves the softness of the hair? Is it collagen, melanin, elastin, or sebum?
Sebum.
If you chose D, sebum, you are correct. Which nerve fibers carry impulses from the brain to control muscle movement? Is it secretory, sensory, motor, or receptor?
Those would be motor.
Which nerve fibers carry impulses from the brain to control muscle movement? Is it
Yeah,
secretory,
because your brain has to send a
sensory,
signal to
motor,
motorize your
receptor?
arms, motorize your legs. So I'm gonna go with motor.
If you chose C, motor, you are correct.
It's a weird way of remembering shit.
What layer of the dermis contains the lymph glands?
So this one I
Is
do
it
not remember.
reticular, basal cell, granular, or papillary?
Lymph glands.
What
I'm
layer of the dermis contains the
gonna say
lymph
reticular.
glands? Is it reticular, basal cell, granular, or papillary?
I'm gonna turn him down a little bit. I'm gonna go with reticular, but I think I'm gonna get that wrong. So we're going to.
If you chose A, reticular, you
I
are
got it.
correct. Blanks supply nourishment to the skin in the form of protein, carbohydrates, and
That would
fat.
be the blood
Is
and
it
lymph.
sebum and lymph, blood and lymph, water and oxygen, or blood and water?
Blank supply nourishment to the skin in the
Blanks
form of
supply
protein,
nourishment to
carbohydrates,
the
and fat.
skin in the form of protein, carbohydrates, and fat.
I'm gonna go
Is it
blood
sebum
and
and lymph,
lymph.
blood and lymph, water and oxygen, or blood and water?
Not sebum. Not water and oxygen. Water is not even an answer. It's blood and lymph.
If you chose B, blood and lymph, you are correct. What can occur?
So on that last question, I eliminated sebum because sebum is your oils and stuff coming out of your skin. That's the sebaceous gland. And then I eliminated the other answers because I said water, and water does not carry anything.
To the skin when collagen fibers become weakened?
At least in that
Is
sense.
it wrinkles and sagging of the skin tags, fatty tissue, or goosebumps? What
Oh,
can occur
so that's going to be
to the
wrinkles and
skin
sagging
when
of the
collagen
skin.
fibers become weakened? Is it wrinkles and sagging of the skin tags, fatty tissue, or goosebumps?
The wrinkles and sagging.
If you chose A, wrinkles and sagging of the skin, you are correct. The color of the skin, whether
So that
fair
is
or
going to be
dark,
melanin.
depends on genetics and blank. Is it sebum, keratin, melanin, or collagen?
So collagen is what makes the skin firm or not firm. Keratin is a protein in hair. And then sebum, we're back to that sebaceous gland again. Let me confirm that. Let me confirm that on keratin. Because I'm gonna need to know these anyway. So going back here and looking up keratin with a K. I'm just going back to the glossary. We're gonna look up keratin. I was correct. The protein of which hair is made. So keratin. We know some of our shit. There's not enough of it to pass the state board the first time.
The color of the skin, whether fair or dark, depends on genetics and blank.
Which that makes me want to look up the collagen. Like, what's the actual technical for collagen? Or let's go to these. The so collagen COLL. Yeah, a fibrous protein that gives the skin form and strength. And close book. Anyways, the answer to this is melanin.
Keratin, melanin, or collagen.
The color of the skin, whether fair or dark, depends on genetics and melanin.
If you chose C, melanin, you are correct. One of the most prominent characteristics of aged skin is its blank.
Loss of elasticity.
Formation of blackheads, oiliness, loss of color, or loss of elasticity.
That means loss of
one of the most prominent characteristics
when it's saying elasticity, that's being able to pull it and for it to bounce back.
Formation
the loss of elasticity.
Oiliness, loss of color, or loss of elasticity.
Although skin can lose color, but that's not.
If you chose D, loss of elasticity.
Keep that out of your mind. It's not the answer.
What body system controls the activity of sweat glands, which regulate body temperature and help to eliminate waste products from the body?
So this is
circulatory, nervous, endocrine, or lymphatic immune?
Regulate body temperature and help to eliminate waste product from the body.
Glands, which regulate body temperature and help to eliminate waste products from the body.
So
is it circulatory?
In a logical sense, the answer would be circulatory.
Endocrine, or lymphatic immune?
I would say circulatory. But I think it's nervous. Yeah, it's nervous.
If you chose B, nervous, you are correct.
So if we look up the nervous system, let's go into the N, because I'm going to look up the entire reason on why the nervous system is responsible for that. So this is chapter 9. So let's just go to chapter 9. And then I'm going to look for the nervous system. This is sebum, sebaceous glands, sudoriferous glands, collagen, elastin. Understand skin cancer. Where is it at? Okay, I'm not seeing something standing out going nervous system. So we're gonna go back to nerves in the thing. In the glossary. And it says, oh, nervous system is on 148. It's 234. So let's go back to 148, which is in chapter 6. Okay, so circulatory controls movement of blood throughout the body, heart, blood vessels, and then nervous coordinates with all other body systems, allowing them to work efficiently and react to the environment. Brain, spinal cord, nerves, and eyes. So basically, without the nervous system, nothing in our body would work. So that's the transmitting system from brain to body. So I'm looking to see, because I like to read it word for word, like nervous system responsible for blah, blah, blah. Right here, the nervous system. So the principal components of the nervous system are the brain, the spinal cord, and the nerves themselves. The nervous system is divided into two main subdivisions: the central nervous system and the peripheral nervous system. The central nervous system consists of the brain, cranial nerves, spinal cord, and spinal nerves. It controls consciousness and all mental activities with functions of the five senses and voluntary muscle actions, including all body movements and facial expressions. The peripheral nervous system is made up of sensory and motor nerve fibers that extend from the brain to the spinal cord to all parts of the body. Their function is to carry impulses or messages to and from the central nervous system. Subdivisions of the peripheral nervous system are the automatic and somatic nervous systems, which control involuntary and voluntary functions and actions. So, involuntary is like your heart, it just does it on its own. Voluntary is like moving your arm and shit. So the autonomic nervous system is like your spinal cord. I don't know, it just says ANS. It's not really telling. Sensory nerves are also known as afferent nerves, carry impulses or messages from one sense organs, where sensations such as touch, cold, heat, sighting, hearing, taste, smell, pain, and pressure are experienced. Motor nerves, also known as efferent nerves, so efferent, carry impulses from the brain to the muscles or glands. This transmitted impulses produce movement. So it's the nervous system that controls the activity of sweat glands and regulate body temperature and help eliminate waste products from the body. I'm not seeing that in this book. I'm sure it's in here somewhere. Wish it would just stick out and be like, right here, the nervous system. It is responsible for. Oh well, we'll move on. So we know it's the nervous system. Circulatory, I was thinking that because your blood moves waste, but it almost it's like almost, well, what kind of waste are we talking about? So I guess in the grand scheme of things, the nervous system is the main system that controls everything. So that would the nervous system is what also makes the circulatory work. So you would put circulatory underneath nervous, and then all those other systems have to go underneath nervous. So nervous is like the main umbrella, and everything else falls underneath it. So that would be why the answer would be nervous. And I need to start thinking about questions in that way too. It's like, well, how many of these categories fit under the main category?
The outermost layer of the epidermis is covered with a thin layer of sebum, which makes skin blank. Is it
Waterproof.
waterproof, taut, absorbent, or sensitive?
Waterproof. That's why
The
water actually
outermost
beads
layer
up and
of
rolls
the
down your skin.
epidermis is covered with a thin layer of sebum, which makes skin blank.
And if you
Is it
shave your
waterproof,
arms, it'll roll off
taut,
even more.
absorbent, or sensitive? If you chose A, waterproof, you are correct. What is sebum secretion affected by? Is it injury,
Hormones.
pathogens, heat, or hormones?
I'm gonna say hormones.
What is
Because in
sebum
those teenage
secretion
years,
affected by?
in those teenage
Is it
years, when your hormones are starting to kick in and you get that acne face and acne all over your body, that's your hormones.
injury, pathogens, heat, or hormones?
And sebum secretion is oil. So oily face turns into dirt, fills in the pores. You get
If you
whiteheads or
chose
blackheads.
D, hormones, you are correct. How much do humans perspire daily?
1 to 2
Is
pints of
it
sweat.
1 gallon, 1 to 2 cups, 1 to 2 pints, 1 to 2 quarts? How much do humans perspire daily? Is it 1 gallon, 1 to 2 cups, 1 to 2 pints, 1 to 2 quarts?
1 to 2 pints.
If you chose C, you are correct. 1 to 2 pints. Blank is a function of the skin that protects the body from the environment. Is it secretion, heat regulation, absorption, or excretion? Blank is a function of the skin that protects the
I'm gonna go
body
with
from the
heat
environment.
regulation.
Secretion, heat regulation, absorption, excretion.
Heat regulation.
If you chose B, heat regulation, you are correct. The skin protects the body from injury and blank. Is
Pathogens.
it pain, pressure, pathogens, emotional stress?
I wish it was emotional stress.
The skin protects the body from injury and blank. Is it pain, pressure, pathogens, or emotional stress?
Okay, so we all know it's obviously not emotional stress because we all have some sort of emotional stress, whether we're happy. Is that really an emotional stress or an emotional release? Anyways, emotional stress is not the answer. Pain, you feel pain on your skin, but that's from the receptors of the nerves. Pressure, you can feel pressure when somebody's pushing on you. Pathogens are can only get into your skin if there is a cut or an opening somewhere on your skin. But you can still breathe in pathogens, and you can still, uh, well, through the nostrils is still breathing, so you could breathe in pathogens as well. That's why we had to wear masks during COVID.
If you chose C, pathogens, you are correct.
And most of the time when I'm giving these explanations, this is how it makes sense to me in my head. It's not that I'm trying to teach you because I'm not an instructor or anything like that. It's just if I say this stuff out loud, then I'm able to retain it easier.
A blank is a small blister or sac containing clear fluid lying within or just beneath the epidermis.
Clear fluid.
Is it tumor, nodule, macule, or vesicle?
I'm gonna go vesicle.
A blank is a small blister or sac containing clear fluid lying within or just beneath the epidermis.
Because I think of
Is
this
it
as like a
tumor,
lesion or
nodule,
a
macule, or
fissure,
vesicle?
but I'm gonna go vesicle. And if it's not, then we gotta look it up.
If you chose
All
D,
right.
vesicle, you are correct. An example of a bulla is blank. Is it impetigo, severe acne, lipoma, a liver
Bulla.
spot?
Example of a
An
bulla
example
is,
of a bulla is a blank.
and it's a
Is
bulla,
it
not
impetigo,
Ebola.
severe acne, lipoma, a liver spot?
I keep pulling to liver spot, but I'm really not 100% sure on this one.
If you
Okay,
chose A,
impetigo.
impetigo, you,
So impetigo. Impetigo is a bulla. Impetigo. So this is one where I got it wrong, so I gotta go in here and look up impetigo, GHI, if I can remember the alphabet. Infectious internal IM before IN. That's really not immune system, immunity, implements, inactive, inclined, income. Where? Where is? Okay, so maybe it's not impetigo. So let's go look up bulla. Maybe impetigo is not a term in this book. I think they would have both. So bulla, bulla, large blister containing a watery fluid. So that's the term for bulla. Impetigo is not in that part. So let's go to page 230. Let's turn to page 230 in our textbooks class. Wish I had a bigger desk so I could actually just set this book down on there. But I got the keyboard, mouse, 2 monitors. I don't have the space. So there's 234, 232, 230. So bulla, large blister containing a watery fluid similar to a vesicle. Okay. Requires medical referral. Contact dermatitis, large second-degree burns, bullous impetigo. There it is. So if you remember the term bullous impetigo, so bullous impetigo, that's the full name of one of the examples, bullous impetigo. So remember, an example of a bulla is bullous, bullous impetigo. I was on one of those photo charts, and that's why I didn't know I didn't see the impetigo terminology.
You are correct. Which of the following primary lesions requires a medical referral? Is it a macule, cyst, papule, or pustule?
That is going to be a cyst.
Which of the following primary lesions requires a medical referral? Is it macule, cyst, papule, or pustule?
So I have this huge like lump right here in my jawline, and I don't do chewing tobacco, so I don't think it's anything like that. Like whatever, and it's been there for a long time. Um, but that would be, I would think, a cyst. So this would need medical attention. I wouldn't be able to do that as a barber. So because of it saying medical referral, I think of a cyst, which I
If
wouldn't
you
want to deal with
chose
any of
B,
those, to be
cyst,
honest.
you are correct. A wheal can be caused by blank.
Mosquito
Is
bite.
it acne, poison ivy, a mosquito bite, or second degree burns? A wheal can be caused by blank. Is it acne, poison ivy, a mosquito bite, or second degree burns?
A mosquito bite.
If you chose C, a mosquito bite, you are correct. An abnormal mass varying in size, shape, and color is a blank.
Sending my wife a
Is
photo.
it tumor, cyst, bulla, or nodule?
And color. Let's
An abnormal
go.
mass varying in size, shape, and color is a blank. Is it tumor, cyst, bulla, or nodule?
It's either tumor or nodule. I'm gonna go tumor.
If you chose A, tumor, you are correct. Severely cracked or chapped hands or lips is considered an blank. Is it ulcer, crust, fissure,
That's
or
a fissure.
keloid?
That's for sure a fissure.
Severely
A
cracked or chapped
fissure.
hands or lips is considered an blank. Is it ulcer, crust, fissure, or keloid?
For sure, fissure.
If you chose C, fissure, you are correct.
And I remember fissure from um like a fissure in the earth, a big huge crack in the earth, like really dry land can tend to have fissures, and then when the tectonic plates and all that stuff, I like that's a way detailed way of remembering fissure. And it may not be your way of remembering, but that's my way of remembering. Like the San Andreas Fault is a fissure in the earth.
And excoriation could be caused by blank. Is it chickenpox,
That is
psoriasis,
gonna be
a
nail biting.
post-operative repair, or nail biting? An excoriation could be caused by blank. Is it chickenpox, psoriasis, a post-operative repair, or nail biting?
Nail biting. I don't remember the in detail on why those two even go together. So this is where the in-depth reasoning comes into play. So if I look up excoriation, it might explain why nail biting is that terminology. And it's one of those things like, yes, I know that that's the answer, but at the same time, I need to know why that's the answer. So, excoriation, skin sore or abrasion caused by scratching or scraping, which still doesn't really link us to a nail biting. That's, you know, I guess you're scratching and scraping your teeth on your nails. Me, when I bite my nails, I actually bite them like a pair of clippers. Like I'll actually get the whole nail off of there. I know that's gross, but then I probably shouldn't have shared that, but I did. Um, so let's go to page 232 in the Malati Standard Book of Barbering. So if we go to 232 and then we look at excoriation, that is a nasty, nasty thing. Okay, so it says skin sore or abrasion produced by scratching or scraping. So that really didn't like connect this, but this next term, an example, nail cuticle damage from nail biting. That can call excoriation. And then let me just show you this photo of what that looks like. Down here. So you can see these nails right here. That's what happens when you get that excoriation. So it's damage to the cuticle itself. The nail cuticle. Try not to get cuticle in nails confused with cuticle of hair.
If you chose D, nail biting, you are correct. Which of the following is a thick scar resulting from excessive growth of fibrous tissue? Is it excoriation,
I'm gonna go with a keloid.
keloid, cicatrix, or crust? Which of the following is a thick scar resulting from excessive growth of fibrous tissue? Is it excoriation, keloid, cicatrix, or crust?
Keloid. I don't know why that just sounds like it's the right answer.
If you chose B, keloid, you are correct. What type of lesions are characterized by an accumulation of material on the skin surface or by depressions in the skin surface? Is it secondary?
What type of lesions are characterized by an accumulation of material on the skin surface or by depressions in the skin surface? So it's either a stack of skin or a skin cave. So it's going to be primary or secondary. So what's... I'm going to go secondary lesion.
Minor, primary, or major. What type of lesions are characterized by an accumulation of material on the skin surface or by depressions in the
Watch, it's not
skin
going to be primary
surface?
or secondary. I'm going to be completely with this.
Secondary, minor, primary, major.
I'm going secondary. I'm sticking to it. Then I'm going to have to go look.
If
It's
you chose
secondary.
A,
Okay, so this is the dumbest thing I ever came up with in my head to make it make sense. Is that the primary lesion is the beginning. Like that's the very first time you've ever done anything. Like, so calluses on your hand, that first initial primary lesion is what caused the skin to start repairing itself. And then you go over it and over it and over it again, which is the secondary. So after the primary, the first lesion, that was the initial activation of, hey, let's repair. And then as you use your hands more and more and more, you build calluses, which is the secondary lesion, which is the after fact from the primary. So the primary was the cause, secondary is the effect. That's how I came up with that answer. I'm like, it's got to be secondary because, and then minor, major, I didn't even put them into play.
secondary, you are correct. Psoriasis is characterized by a and blank. Is it accumulation of sebum and pus, thin, dry, or oily plate of epidermal flakes?
So because psoriasis is normally flaky, I would think the answer would be B because it says thin, dry, or oily plate of epidermal flakes. Epidermal is also meaning the epidermis, which is the outside layer of the skin. That's why I'm going to stick with B,
Crack in the
epidermal
skin that
flakes.
penetrates the dermis, open lesion
But
on the
flakes being
skin
the
or
key
mucous membrane.
to that.
Psoriasis is characterized by a and blank. Is it accumulation of sebum and pus, thin, dry, or oily plate of epidermal flakes, crack in the skin that penetrates the dermis, open lesion on the skin or mucous membrane?
Yeah, I'm going to stick with B.
If you chose B, thin, dry, or oily plate of epidermal flakes, you are correct. Which of the following is a recurring viral infection that produces fever, blisters, or cold sores characterized by a single vesicle or group of vesicles with red, swollen bases?
I'm going to go with
Is
herpes
it
simplex 1.
psoriasis, eczema, herpes simplex 1, IV dermatitis?
So if they'd have put herpes simplex 2 up there, I would have probably went back and forth on those two answers. But I'm pretty sure it's herpes simplex 1. Recurring viral infection that produces fever, blisters, or cold sores. Yeah, I'm going with herpes simplex 1.
Which of the following is a recurring viral infection that produces fever, blisters, or cold sores characterized by a single vesicle or group of vesicles with red, swollen bases? Is it psoriasis, eczema, herpes simplex 1, or IV dermatitis? If you chose C, herpes simplex 1, you are correct.
So the difference between herpes HSV1 and HSV2, this, if you don't want to listen to this, that's fine, but it says 50 to 80% of American adults have oral herpes, which causes cold sores or fever blisters in or around the mouth. Genital herpes caused by HSV1 or HSV2 affects 1 out of every 6 people in the U.S. age 14 to 49. Genital herpes infections can be asymptomatic, which means they don't show any symptoms, and then or can show up as outbreaks of blisters and sores. These common viral conditions are transmitted through intimate person-to-person contact. In the case of HSV1, kissing or oral sex can spread the infection to one person to another person, while HSV2 can be contracted through vaginal, anal, or oral sex with someone who has the virus. A mother infected with a herpes virus can transmit the virus to her baby during birth if the virus is active at that time. In rare cases, infection with HSV1 or HSV2 can lead to meningitis, which is inflammation of the covering of the brain and spinal cord, or encephalitis, inflammation of the brain. Treatment for herpes infections can lessen the frequency or intensity of outbreaks. That's not exactly the 1 and 2 separate. So HSV1 is on the mouth, cold sores, blisters. HSV2 is the genital area. So HSV1 above waist, HSV2 below the waist. This blank occurs when irritating substances such as chemicals or tints temporarily damage the epidermis. Irritant contact dermatitis?
Blank occurs when irritating substances such
It's
as
not.
chemicals or
It's not herpes
tints
simplex 2. It's not that.
temporarily damage the
So it's
epidermis.
irritant contact
Is it
dermatitis.
irritant contact dermatitis, eczema, psoriasis, or
Because
herpes
of it being
simplex
triggered
2?
by a substance, I would say irritant contact
Blank occurs
dermatitis.
when irritating substances such as chemicals or tints temporarily damage the epidermis. Is it irritant contact dermatitis, eczema, psoriasis, or herpes simplex 2?
So, have you ever had anybody tell you not to touch the insulation that's in your garage or in your walls or whatever because it can be irritating to your skin, but then it goes away, right? So, irritating contact. The dermatitis, I don't really know what that term is, but because of the irritant contact being triggered by a substance, that's why I would go with A. And if I'm wrong,
If you chose A,
think
irritant contact
thinking with
dermatitis,
logic
you are
gets you there.
correct. Which of the following conditions may spread to other parts of the body by contact with contaminated hands, clothing, or objects? Is it irritant contact dermatitis, IV dermatitis, eczema, or dermatitis?
I'm going to say IV dermatitis
Which of the
because that
following
is
conditions may
normally
spread
from like
to other
poison
parts of the
oak,
body
poison
by
ivy, and that could be
contact with
transmitted person to
contaminated
person
hands,
with
clothing,
contact.
or objects? Is it irritant contact dermatitis, IV dermatitis, eczema, or dermatitis?
I'm going to go with IV dermatitis.
If you chose B, IV dermatitis, you are correct.
Let's fucking
Blank
go.
usually occurs on the scalp, elbows, knees, chest, or lower back, but rarely on the face. Is it
Eczema.
eczema, herpes simplex 1, herpes simplex 2, or psoriasis?
Shit.
Blank usually occurs on the scalp, elbows, knees, chest, or lower back, but rarely on the face. Is it eczema, herpes simplex 1, herpes simplex 2, or psoriasis?
I said eczema. I'm going to stick to it. It's probably psoriasis.
If you
Okay.
chose D, psoriasis.
So psoriasis. Psoriasis occurs where? I'm just using my phone because it's faster. Shoulders, chest, pants, shoes. No. Psoriasis can appear in any area of the body, but it commonly affects the following areas: elbows and knees, scalp, lower back, nails, genitals, joints, face, feet and palms, other areas. Psoriasis can also appear on less common areas such as the buttocks, chest, and thighs. So it's psoriasis. It's not eczema. Because then you have the pityriasis, which I don't remember what that is, but I feel like that's something that's on the scalp. So I should have been like, oh, connect those two.
You are correct. Dermatitis lesions may appear in various forms, such as blank. Is it wheals, fissures, vesicles, or nodules?
Dermatitis lesions may appear in
Dermatitis
various
lesions
forms,
may
such
appear
as.
in various forms, such as blank. Is it wheals, fissures, vesicles, or nodules?
I don't know this one either, but I'm gonna go fissures because it's a lesion.
If you chose C,
Fudge. A vesicle. Okay, so what is vesicle? Do not autocorrect the vehicle. So a vesicle is a small membrane-bound sac that functions as a transport vehicle within a cell. Funny. They are involved in various cellular processes, including secretion, waste disposal, and intercellular transport. Vesicles can be formed naturally by the cell or artificially, like liposomes, and they play a vital role in maintaining cellular organization and functions. So, vesicle is a small spherical compartment enclosed by a lipid bilayer membrane. So what? So dermatitis lesion may appear as. Not interested in AI. Dermatitis lesions can appear in various forms, often as itchy, red, and inflamed patches or bumps. They may also be scaly, dry, cracked, or blistered. Okay, so that's like, okay. They may also be scaly, dry, cracked, or blistered. In some cases, lesions can ooze or crust over, and scratching can lead to thickened, leathery skin. The appearance can vary depending on the type of stage of dermatitis, as well as individual skin tone and affected area. Okay, so I'm going to say dermatitis lesion versus vesicle. A vesicle is a specific type of skin lesion characterized by a small fluid-filled blister. Okay. Typically less than 10 millimeters in diameter. Dermatitis, on the other hand, is a broader term for referring to inflammation of the skin, which can manifest in various ways, including the presence of vesicles, but also including other types of lesions like papules, plaques, or even just redness and itching. Okay, so to just wrap all this up, it's a vesicle is a specific type of skin lesion, so a dermatitis lesion, characterized by a small fluid-filled blister, typically less than 10 millimeters in diameter. So fluid-filled blister, and it's a type of skin lesion. So a vesicle is a type of dermatitis lesion. Dermatitis being on the skin. Sure.
Vesicles, you are correct. Excessive oiliness on the skin or scalp may indicate the presence of blank. Is it
Seborrhea.
milia, telangiectasis, rosacea, or seborrhea? Excessive oiliness on the skin or scalp may indicate the presence of blank. Is it milia, telangiectasis, rosacea, or seborrhea?
His face was like, I can't read that. I'm going seborrhea.
If you chose D,
So because of excessive oiliness on the skin, that's talking about sebum, which is the sebaceous gland, which is seborrhea. So sebum, sebaceous, seborrhea.
seborrhea, you are correct. Which of the following disorders of the sebaceous glands is commonly associated with newborn babies? Is it seborrhea, milia, open comedo, or whitehead?
Open
Which
comedo.
of the following disorders of the sebaceous glands is commonly associated with newborn babies? Is it seborrhea, milia, open comedo, or whitehead?
Malia. Milia. Milia.
If you chose B, milia, you are correct.
So milia is like those tiny little white spots, um, which if they get big enough, they look like the tiniest little whiteheads. But milia are like little tiny white dots, and they're like clogged pores. So they're like a whitehead, but they're not. I don't really know how to explain that, but I just remember little white dots on baby heads. My
What
wife,
disorder
she's
of
like,
the
"You're cute," as I sent her that
sudoriferous
picture.
glands can be life-threatening and requires medical attention? Is it anhidrosis, bromidrosis, hyperhidrosis, or malaria
What disorder
rubra?
of the sudoriferous glands can be life-threatening?
What disorder of
Anhidrosis.
the sudoriferous gland
So anhidrosis, I believe, is the absence of moisture. Hyperhidrosis, I believe, is the excessive side of stuff, and bromhidrosis is about smell. Miliaria rubra. I'm gonna stick with anhidrosis.
can be life-threatening and requires medical attention? Is it anhidrosis, bromidrosis, hyperhidrosis, or malaria rubra?
B A. Answer is A. Tell me it's A.
If you chose A, anhidrosis, you are correct.
Okay, so let's just look that up real quick. So anhidrosis. I looked up. Hang on. Let me go back like just a pip. So very interesting. Okay, so it's not hyperhidrosis, it's hypohidrosis. So that's why hyper is not the answer. Hypohidrosis, also known as anhidrosis, is a rare condition that causes the body to produce little or no sweat. So that's what I was saying. Yeah, okay. So it's the lack of water was what I was thinking. So I was on the right track, but not quite at the right answer. So hypohidrosis, also known as anhidrosis, is a rare condition that causes the body to produce little or no sweat. It can affect the entire body or just a small area. Hypohidrosis can be life-threatening because sweating is essential for regulating body temperature and preventing overheating. Symptoms include decreased sweating or heat intolerance. So you might meet somebody that it's got to be cold all the time because they can't sweat properly. So I'm not sure in what way that I'm guessing it's just because you can't regulate your body temperature. So if you overheat, you basically like pass out and cook. And then stuff will start shutting down because it's really bad. Three main causes of anhidrosis, which are peripheral alterations in the eccrine gland itself, idiopathic and central or neuropathic disease, and or medication that disrupts neural inputs from the anterior hypothalamus to the gland. That didn't give me any answers. I need it in dummy terms, like you don't sweat, you're gonna die. Like, you know what I mean? So, because they can't sweat and therefore can't cool their bodies, people with severe anhydrosis have trouble working and exercising and can be in serious danger if they attempt strenuous activity in high temperatures. So, do not work in a warehouse if you have severe anhydrosis. Okay, so now if I just hit forward, I'll go ahead and just listen to him say anhydrosis again.
If you chose A, anhydrosis, you are correct.
And if you can't remember the sudoriferous gland, don't even pay attention to that part. Pay attention to life threatening when it's talking about this. And that would be the way to remember that.
Blank results in foul-smelling perspiration.
This is
Usually
bromhydrosis.
noticeable in the armpit.
So yesterday I didn't have any deodorant, so I had to walk around with my bromhydrosis. I didn't have any way to nerf my bromhydrosis.
It's or on the feet. Is it hyperhidrosis, malaria rubra, bromhidrosis, anhidrosis? Blank results in foul-smelling perspiration, usually noticeable in the armpits or on the feet.
Like how you
Is it
read that.
hyperhidrosis,
Usually
malaria rubra, bromhidrosis, or anhidrosis?
bromhydrosis, like bro. Mydrosis.
If you chose C, bromhidrosis, you are correct. What disorder of the sudoriferous glands is caused by exposure to excessive heat and usually clears in a short time without treatment?
Okay, so I think Malaria rubra is the malia. It's like the longer term for malia that the babies get. So because bromhydrosis is when somebody doesn't, it's sometimes it's not controllable. Sometimes deodorants don't work for it. So it's excessive stanky. So bromhydrosis, you stank, bro. Hyperhidrosis is not the correct term. It's hypo, so we can eliminate hyper. And then anhydrosis is when you don't have the ability to sweat. So that leaves us with D, process of elimination.
Is it bromhidrosis, hyperhidrosis,
Malaria rubra.
anhidrosis, or malaria rubra?
Malaria.
What disorder of the sudoriferous glands is caused by exposure to excessive heat and usually clears in a short time without treatment?
Malaria. Hang on. Is malaria that stuff that you can get when you're in Africa, like because it's so fucking hot? Malaria. Red rash with blisters. It's a heat rash. Malaria. Okay. Malaria. Spelled Miliaria. So the one we're seeing right here is a heat blister. But the malaria I was thinking of, which is Malaria, so it's got one less I. So after the L, if you take the I out, that's a different malaria, which is a mosquito-borne infectious disease in the Far Cry series. So I was thinking, but that you have to take medication for.
Is it bromhidrosis, hyperhidrosis, anhidrosis, or malaria
It's the malaria
rubra?
rubra.
If you chose D, malaria rubra, you are correct.
You are correct.
What is the technical term for freckles?
Oh.
Is it vitiligo, lentigines, leukoderma, or hypopigmentation? What is the technical term for freckles?
I don't know.
Is it vitiligo?
This was the first answer I thought it was in my head,
Leukoderma,
so I'm
or
going to stick to it.
hypopigmentation?
Hypopigmentation, I don't know if that happens in the entire skin or if it's just spots. If it is spots, then it's
If you
okay.
chose B, then
Okay, so lineagens is the correct answer. I try to stick with what I think it is for the first answer, but I was kind of teetering on whether it was lineagens or not, so I got that one wrong. So what is hypopigmentation? Hypopigmentation. So hypopigmentation is a skin condition that causes lighter areas of skin due to a loss of pigment. Hypo. Okay. So hyperpigmentation. Hyper, like all jacked up. You know, like kids, like when kids get hyper, they're like, oh, full of energy. So hyper would be like your skin is full of pigmentation. So let me see if that's a term. Hyperpigmentation. Yes, so hyper. Oh, okay, so hyperhidrosis is a thing. Abnormally excessive sweating. So hyperhidrosis is excessive sweating. Hypo, also known as anhidrosis, is not being able to sweat. So remember that, class. I want hyperpigmentation, which I would assume there's a term for that. So hyperpigmentation are the darkened patches or spots on the skin. So hypo, you're going lighter. Hyper, you're going darker. So if hyperpigmentation was on there, that would have been an answer as well that would have been correct. But it was either hypo or lineagen. So since it was hypo, which is, you get it, you got it. So there's hypo and hyper on the anhidrosis and on pigmentation. So I'm going to look up lineagens. Lineagens are small, brown, well-defined spots on the skin that are caused by increased melanocyte activity. They are a type of hyperpigmentation linked to aging and sun exposure. So, like I was saying, I was on the right track. So, hyperpigmentation and lineagens are the same thing.
Tigenines, you are correct. An absence of melanin pigment in the body, including the skin, hair, and eyes, is known as blank.
Absence
Is
of
it
melanin, that's
albinism,
albinism.
leukoderma, hyperpigmentation, or chloasma?
So, albinism, meaning albino,
An absence of melanin
is
pigment
really
in
pale
the body,
skin,
including the skin,
usually
hair, and eyes, is
slightly
known
blonde
as
or
blank.
white hair.
Is it albinism, leukoderma,
Eyes
hyperpigmentation,
can
or
usually look
chloasma?
red.
If you chose A, albinism, you are correct. Which of the following changes in the pigmentation of the skin is commonly referred to as liver spots in older adults? Is it
Leukoderma.
chloasma, leukoderma, lentiginines, or nevus?
I'm I'm pulling leukoderma because
Which of
that's
the
the one I
following
reckon. That's
changes
the
in the
term I
pigmentation of
recognize.
the skin is commonly referred to as liver spots in older adults? Is it chloasma,
Leukoderma.
leukoderma, lentiginines, or nevus? If you chose
What?
C, lentiginines, you are.
Hang on. Which of the following changes in the pigmentation of the skin is commonly referred to as liver spots in older adults? It does. Okay, so I looked up not vitiligo. I said leukoderma. The answer is lentigens. Because I looked up leukoderma, it says one of the leading theories regarding the cause of leukoderma involves an autoimmune response where the body's immune system mistakenly targets and destroys melanocytes, the cells responsible for producing melanin, the pigment that gives skin its color. But it's lineagens again. Let me look up, is leukoderma a type of lineagen? Because if it is, then that would mean no, leukoderma is not a type of lineagen. Leukoderma is a broader term that describes white patches or areas of skin due to a partial or total loss of absence of skin pigmentation. This loss of pigment can be caused by various factors, including autoimmune conditions like vitiligo, genetic factors, chemical exposure, or skin trauma. Lineagens are pigmented spots, typically brown or dark, caused by an increased number of melanocytes in the skin. They are commonly known as age spots or liver spots and are often associated with sun exposure or aging. All right, so lineagens, liver spots. Lineagen, liver spots. Okay.
Correct.
Which now I want to look at what's cloasma. Cloasma. Cloasma, a condition in which brown patches appear on the face. Oh, that's not cloasma. That's melasma. Cloasma, also known as melasma, okay, or the mask of pregnancy, is a pigmentation disorder of the skin characterized by darker skin patches that primarily affect the face and other sun-exposed areas. Like, a lot of these answers lead to same results. So it's cloasma, leukoderma, lineagens, and nevus. So what is nevus? A common pigmented skin lesion, usually developing during adulthood. Most people develop several moles or nevi throughout adulthood. So nevus is like a mole. Oy, why do we have so many terms that
Blank
lead us
is
to the same
caused by
thing?
a burn, scar, inflammation, or congenital disease that destroys the pigment producing cells. Is it lentigines, vitiligo, albinism, or leukoderma? Blank is
That
caused
was,
by a
I just
burn,
read this. That would
scar,
be vitiligo, right?
inflammation, or congenital
Because the
disease
body
that destroys the
accidentally
pigment producing cells.
mistaken
Is
something
it
and starts
lentigines,
attacking those cells.
vitiligo, albinism, or leukoderma? If you chose
What
B,
the?
leukoderma, you are correct.
What? Okay, so we're gonna put exactly what this says. Blank is caused by a burn, scar, inflammation, or congenital disease that destroys the pigment producing cells. So that's hypopigmentation, characterized by a loss of skin color, can be caused by various factors, including burns, scars, inflammation, and congenital conditions that damage melanocytes, the pigment producing cells. Conditions like vitiligo, a disease where the immune system attacks melanocytes, can also lead to hypopigmentation. Additionally, post-inflammatory hyperpigmentation, a reaction to skin inflammation, can cause a temporary loss of pigment. So vitiligo was not technically wrong, but vitiligo is a disease where the immune system attacks melanocytes. So that's why when I thought it said disease that destroys pigment producing cells, I thought vitiligo. Leukoderma. Even when you type in leukoderma in Google, it pulls up vitiligo. So that's one of those examples where leukoderma is your big umbrella and vitiligo fits under that umbrella. So leukoderma involves an autoimmune response. Okay. The leukoderma, the one going out and attacking shit.
Cells. Is it lentiginines, vitiligo, albinism, or leukoderma?
He pronounces some of these names weird. Lentiginines? It's like
If you chose
lineagens.
D, leukoderma, you are correct. Skin with
The
vitiligo
vitiligo
must be blank.
protected from
Is it
exposure to
protected
the
from
sun, exposed to sunlight
overexposure
and
to the
air,
sun,
foliated or treated by
exposed to
dermatologists, treated by
sunlight and air,
antibiotics?
exfoliated or treated by a dermatologist, or treated with antibiotics?
I'm gonna say protected from overexposure to the
Skin
sun.
with vitiligo must be blank. Is it protected from overexposure to the sun, exposed to sunlight and air, exfoliated or treated by a dermatologist, treated with antibiotics?
I just confirmed my answer. I went ahead
If
and
you
looked it
chose
up.
A, protected from overexposure to the sun, you are correct. Which of the following is also known as a birthmark? Is it stain, nevus, chloasma, vitiligo?
Is it nevus or
Which of the
chloasma?
following is also known as a birthmark? Is it stain, nevus, chloasma, vitiligo?
Didn't chloasma something with the sun? I'm gonna go with nevus.
If you chose
Yeah.
B, nevus, you are
Or
correct.
nevus.
A callus is a blank that is caused by continued repeated
Heated
pressure
pressure
or friction on
friction
any part of
part
the
of the
skin.
skin.
Is it chloasma, verruca, keratoma, leukoderma?
I'm gonna
A
say
callus is a blank that is caused by continued repeated pressure or
this is
friction on
definitely one that
any
I
part of the
need to read the
skin.
chapter and get more details. I'm gonna say
Is it
keratoma.
chloasma, verruca, keratoma, leukoderma?
Keratoma.
If you chose C, keratoma, you are correct.
I just went off of a
Any change
callus.
in a mole
Keratoma.
requires blank. Is it removal, exfoliation, protection from overexposure of the skin, medical attention?
So it needs medical attention
Any
before it
change
would
in
need
a mole
removal.
requires blank. Is it removal, exfoliation, protection from overexposure of the sun, or medical attention?
I'm gonna say medical attention because those other three would be provided by the person that tells them what they need to do.
If you chose D, medical attention, you are correct. Which of the following is caused by a virus and is infectious? Is it
It's a wart.
mole, wart, skin tag, keratoma?
Wart. There's a
Which of the
toad.
following is caused by
Toads will
a
give you a wart.
virus and is infectious? Is it mole, wart, skin tag, keratoma?
It's a wart. I was a young warthog. Sorry.
If you
That
chose
has
B,
nothing to do with
wart,
anything.
you are correct. Blank can spread from one location to another, particularly along a scratch in the skin. Is
Veruca.
it verruca, vitiligo, leukoderma, hypopigmentation?
Veruca.
Blank can spread from one location to another, particularly along a scratch in the
Almost
skin.
like a Hayukin, like
Is it
Veruca.
verruca, vitiligo, leukoderma, hypopigmentation? If you chose A, verruca, you are correct. If the thickening of a callus grows inward, it is
Corn.
called a blank. Is it
You corny
verruca,
motherfucker.
wart, corn, or blemish? If the thickening of a callus grows inward, it is called a blank. Is it verruca, wart, corn, or blemish?
Excuse me.
If you chose C, corn, you are correct. Where do skin tags most
Neck
frequently
and chest.
occur? Is it face, neck and chest, hands and feet, or scalp?
Neck and chest.
Where do skin tags most frequently occur? Is it the face, neck and
Skin
chest,
tags are
hands
also
and
known
feet,
as a
or scalp?
hypertrophy. Hypertrophy.
If you chose B, neck and chest, you are correct. The most common and least severe skin cancer is blank. Is it basal cell carcinoma, basal cell melanoma,
Oh, the least
squamous
severe?
cell carcinoma,
I'm
malignant melanoma?
gonna say basal cell
The most
melanoma.
common and least severe skin cancer is blank. Is it basal cell carcinoma, basal cell melanoma, squamous cell carcinoma, malignant melanoma?
It's basal cell melanoma. That's what I'm going with. Can't remember if it's
If you
it's
chose
fine.
A, basal cell
I was thinking
carcinoma,
carcinoma or
you are
melanoma.
correct.
Like which one is it?
What type of skin cancer is characterized by black or dark brown patches on the skin that may appear uneven in texture, jagged, or raised? Is it squamous cell melanoma, basal cell carcinoma, malignant melanoma, squamous cell carcinoma?
Okay, so I'm gonna go back to the basal cell. Um so basal cell melanoma versus basal cell carcinoma. Basal cell carcinoma, BCC, and melanoma are both types of skin cancer, but melanoma is generally considered more serious due to its higher risk of spreading to other body parts. Okay, so carcinoma and melanoma are both types of skin cancer, but the melanoma is higher risk because it can spread. Okay. Melanoma can spread, carcinoma kind of stays still. What type of skin cancer is characterized by dark black and dark brown? Um, Texture, jagged, or raised? I'm gonna go squamous cell carcinoma.
What type of skin cancer is characterized by black or dark brown patches on the skin that may appear uneven in texture, jagged, or raised? Is it squamous cell melanoma, basal cell carcinoma, malignant melanoma, or squamous cell carcinoma?
I said,
You chose C, malignant melanoma. You are correct.
just the reason I didn't pick that one is because malignant melanoma is the most deadliest, and it's like the worst, and it's untreatable. That's why I didn't pick it. So okay, so jagged, dark, and the dark two made sense. So I should have went malignant melanoma. So it's one of those I knew the answer and should have went with that, and then decided, nah, let's go with this other one.
The American Cancer Society recommends using the ABCDE cancer checklist to help make potential skin cancer easier to recognize. What does the D stand for in this acronym?
Diameter.
Is it diagnosis, duration, distance, or diameter?
We're gonna go with diameter.
The American Cancer Society recommends using the ABCDE cancer checklist
Because when you're
to
trying to
help make
identify
potential skin
something, you want to
cancer
know
easier to recognize.
how big is the
What
spot,
does the D
what
stand
color
for
is
in
it.
this acronym? Diagnosis, duration, distance, diameter.
That's why I'm going diameter.
If you chose D, diameter, you are correct. What vitamin is important to skin and tissue repair?
Vitamin D.
Is it D, C, A,
Remember, Sunny
or
D.
E? What vitamin
Skin and
is
tissue
important
repair.
to skin and tissue repair? Is it D, C, A, or E?
Well, D is from the sun. I know that's important.
If you chose B,
If you chose B, C. All right. Vitamin C is important for repair. Vitamin C. Vitamin C is a water-soluble vitamin found in citrus and other fruits, berries, and vegetables. It is also a generic prescription medication in some countries, is sold as a non-prescription dietary supplement. As a therapy, it is used to prevent and treat scurvy, a disease caused by vitamin C deficiency. Oh. Yes, scurvy dog. That's why you need your vitamin C. So vitamin C, get rid of the scurvy. So what is scurvy? Is that a skin disease? Scurvy, also called scorbutus, a condition caused by a severe lack of vitamin C in the diet. People who don't include enough fruits and vegetables in their diet are at risk. Symptoms may not occur for a few months after a person's dietary intake of vitamin C drops too low. Bruising, bleeding gums, weakness, fatigue, and rash are among scurvy symptoms. Treatment involves taking vitamin C supplements and eating citrus fruits, potatoes, broccoli, and strawberries. What vitamin is important to skin and tissue repair? Vitamin C. Scurvy is a disease caused by low vitamin C over a period of 2 or 3 months. It was common in the past among long-distance sailors because they didn't have access to fruit and vegetables on long trips. Scurvy is still seen today in people who don't eat enough fruit and vegetables. Damn. That makes sense. So in Sea of Thieves, when we're eating the fruit, we're also fighting the scurvy. What does a lack of vitamin D do? Various health issues. Okay, so what vitamin is important to skin and tissue repair? Several vitamins play a crucial role in skin and tissue repair, with vitamin C and vitamin A being particularly important. Vitamin C is essential for collagen synthesis, wound healing, and protecting against oxidative damage. Vitamin A supports skin cell growth, immune function, and overall skin health. So C and A were viable answers there, but C is the more important one apparently.
C, you are correct. Vitamin E blank. Is it promotes healthy and rapid healing of the skin, supports the overall health of the skin, helps to fight against the harmful effects of the sun's rays, is important to skin and tissue repair.
I'm gonna say overall health.
Vitamin E
Because this is
blank.
vitamin
Is
A
it
or vitamin
promotes
vitamin
healthy
A
and rapid
apparently,
healing
or
of the
vitamin
skin,
C.
supports the overall health of the
Or this is
skin,
vitamin C.
helps to fight against the harmful effects of the sun's rays,
I don't know.
is important to skin and tissue repair.
I don't know. What did I say overall?
If you chose C,
Against
helps
harmful
to fight
effects of the
against
sun's
the
rays.
harmful effects of the sun's rays, you are correct. The American Cancer Society recommends using the ABCDE
C is going to be
cancer
color.
checklist to help make potential skin cancer easier to recognize. What does the C stand for in this acronym? Is it character, color, cause, consistency?
It's the C.
The American Cancer Society recommends using the ABCDE cancer checklist to help make potential skin cancer easier to recognize. What does the C stand for in this acronym? Is it character, color, cause, consistency?
Color. Tell me that's color.
If you chose B, color, you are correct. Basal cell carcinoma has what percentage of a survival rate with early diagnosis and treatment?
Oh
Is it
man.
90%, 62%, 94%, or 100%? Basal cell carcinoma has what percentage of a survival rate with early diagnosis and treatment? Is it 90%, 62%, 94%, or 100%?
Let's give it 100. It's probably 94.
If you chose
90.
A, 90%, you are correct. Which of the following skin cancers is the least common of the cancers,
Malignant
but
melanoma.
is 100% fatal if left untreated? Is
That's
it
the one. That's
squamous
earlier when I
cell
said malignant
melanoma,
melanoma.
squamous cell carcinoma, basal cell carcinoma, malignant melanoma?
Malignant melanoma.
Which of the following skin cancers is the least common of the cancers, but is 100% fatal if left untreated? Is it squamous cell melanoma, squamous cell carcinoma, basal cell carcinoma, malignant melanoma? If you chose D, malignant melanoma, you are correct. Early detection and treatment of malignant melanoma can result in a 94% 5-year survival rate, which drops drastically to 62% once it reaches the blank. Is it lymph nodes, scalp, mucous membranes, fibrous tissue?
I'm going to say lymph nodes.
Early detection and treatment of malignant melanoma can result in a 94% 5-year survival rate, which drops drastically to 62%.
I say lymph nodes because when I hear nodes, I think of like receivers, and if the receivers aren't receiving, then they can't do their job.
Once it reaches the blank. Is it lymph nodes, scalp, mucous membranes, fibrous tissue?
I feel like lymph nodes are more crucial
If you
than those
chose
other three
A,
answers.
lymph nodes, you are correct. Using sunscreen with an blank when in the sun is necessary to protect the skin.
SPF 80.
Is it SPF 15, SPF 30, SPF 80, or SPF 100?
I think 100 is overboard, I think.
Using sunscreen with an blank when in the sun is necessary to protect the skin. SPF 15, SPF 30, SPF 80, SPF 100.
SPF 80. Damn,
If you
30.
chose B, SPF 30, you are correct. Blank and protection are the major factors involved in maintaining the skin's overall health and appearance. Is it seeing a dermatologist, medical treatment, diet, or diagnosis?
So seeing a dermatologist is going to be the
Blank and protection
best
are the
answer
major factors
because
involved in
the
maintaining the
dermatologist is going to
skin's
tell you which of
overall
those
health
three.
and
If
appearance.
it's not dermatologist, it's going to be
Seeing a
diet.
dermatologist, medical treatment, diet, diagnosis.
I think we should go with diet.
If you chose C, diet, you are correct.
Yeah. That's the one time it
Which of
doesn't
the
fall under the
following is a
umbrella.
small brownish spot or blemish on the skin, ranging in color from pale tan to brown or bluish black? Is it mole, wart, skin
Moles can do
tag,
that.
or verruca?
Skin tags are usually the same color as the skin.
Which of the following is a small brownish spot or blemish on the skin, ranging in color from pale tan to brown or bluish black? Mole,
I'm going to go with
wart,
mole because
skin
moles
tag,
can do that.
verruca. If you chose A,
Yeah.
mole, you are correct. The change in pigmentation of skin caused by exposure to the sun or ultraviolet light
Is a
is a
tan.
blank. Is it nevus, stain, leukoderma, or tan?
Tan, it's like that's what everybody would say. And it's
The
probably the most
change in
obvious
pigmentation of skin
choosing of an
caused by
answer.
exposure to the sun or ultraviolet light
I'm going to
is
stick
a
with it,
blank.
but it's
Is it
probably they probably
nevus,
want the technical term.
stain, leukoderma, or tan?
I'm going tan. What's the actual answer?
If you chose
Oh,
D,
it is the
tan,
actual
you are
answer.
correct. Characteristics of blank include eyes that are pink and skin that is sensitive to light and ages early. Is it lentiginings, albinism, hyperpigmentation, or vitiligo? Characteristics of blank include eyes that are pink and skin that is sensitive to light and ages early. Is it lentiginings, albinism, hyperpigmentation, or vitiligo?
I'm going to say vitiligo because you have to, I don't know, either albinism.
If you
Okay.
chose B,
I should have
albinism,
went with the
you are
eyes that are
correct.
pink. Albinism.
Which of the following are irregularly shaped dark spots, sometimes found on the scalp and ears, and often first detected by a barber? Is it melanomas, sebaceous cysts, milias, or open comedones?
Regularly shaped dark spots sometimes found on the scalp
Which of the following
and
are
ears.
irregularly shaped dark spots, sometimes found on the scalp and ears, and often first detected by a barber? Is it melanomas, sebaceous cysts, milias, or open comedones?
I want to say open comedones, but it could be melanomas. We're going to go,
If you
yeah,
chose
okay.
A, melanomas, you are correct. Sores that do not heal or unexpected skin bleeding may be symptoms of blank. Is it disorders of the sudoriferous glands, hypertrophies, skin cancer, or dyschromias?
Sores that do not heal?
Sores that do not heal or unexpected skin bleeding may be symptoms of blank. Is it disorders of the sudoriferous glands, hypertrophies, skin cancer, dyschromias?
I would say disorders of the sudoriferous glands. That's not right. It's
If you
skin
chose
cancer.
C, you are correct. Skin cancer. Now, this concludes our review for today.
And we didn't have any ads come across that video. That's cool. All right, so that is going to be the end of our study session. That was 2 hours long. And I did some other studying this morning on some other chapters. Gonna get this resized, fit the frame. So I hope this helped anybody that watches it learn some stuff. This is for multiple state boards that crosses multiple chapters. You can look up any of the chapters on that Howard Brown and watch those and use those to study for your state board. So I'm going to go ahead. I'm going to close this out. That's going to be the end of the studying stream. And then we'll be back on a little later. I'm going to go get food and take care of some things. Maybe let the dogs go outside and do all that. And then we'll be back with our Gears-a-thon later today. So I hope you guys have a great day. If I don't see you later, I appreciate everybody that came by, hung out, watched me study for my state board a little bit more. I've still got a few chapters I'd like to go over, such as the shaving beard design, because there was a lot of hand positions and asking where your fingers are on the straight razor for the shaving, which for hair cutting or shaving beard design, I got 11 out of 16. So it was probably the 5 questions on the hand positions. Like, I could do them, but when you're trying to describe them with wording, I have no idea. So, and of course the test is very in particular, but then in the real world, you know, nobody's going to actually come up and ask you that question, like, ever. So now that I say that, watch, it's going to happen. They're going to be like, I saw your video, so I'm going to ask you, what is the hand position for the free hand? And what's the finger position for the backhand? I'm like, oh my God. I'm like, I don't know. All right, I'll see you guys later. Hopefully you guys can come back for some Gears of War 3 Rom's Shadow. So I've been working on a new thumbnail for Gears of War stuff. I am going to keep the same one that I have right now for Gears-a-thon, but we'll be changing it up when we do other gear stuff. So I'll see you guys later. Y'all have a good one. Bye.